Hey, it's Dr. Centeno. And how do you deal with the frustration of being gaslit if you think you have CCI? Now, listen, there are a lot of patients out there who think they have CCI who probably don't, but there's also a good number of patients who probably do. And one of the issues that we see fairly frequently is that most physicians don't really understand this diagnosis, including spinal surgeons. And we know that's true, right? Because there's about 5 surgeons worldwide that do most of the elective surgery for CCI. And if you go outside of surgeons to non-surgeons and people that do spinal injections, the vast majority of those doctors have no experience or very limited experience with injecting the high upper cervical spine. So you end up in this situation where you're seeing physicians that don't specialize in this particular problem, and it's easy to feel like you're being gaslit. Now, don't get too concerned about that because, like anything else, it usually requires that you see a doctor who has experience in that area in order to get some traction, and they can tell you yes or no, I think you have this problem, i.e. CCI, or I think you don't. But you do have to find the right medical specialist, or you're going to feel a little bit like you're being gaslit, like you have these problems and no one really understands in what box to put those problems. So again, try to find someone that makes this diagnosis all day, every day. You may have it, you may not have it, but it's a good idea to get advice from a doctor that has some experience with that particular problem, in this case, CCI.
Hey, get this out to more patients by like, comment, share, subscribe. Thanks so much.